So for those of us who aren't as familiar with Patients Like Me, can you tell me exactly what the organization is and what the plan is for patients and doctors?
Sure. So PatientsLikeMe.com is a website. It was launched in about 2006, and it really came from the experience of a family affected by motor neuron disease, as I'd call it, or ALS, as the Americans call it. That's the condition that Stephen Hawking has. It's a unfortunately lethal disease, rapidly progressive, 2 to 5 year survival. And the family really struggled with coping with the symptomatic aspects of Stephen's management. So obviously we're all looking for a cure for many of these conditions, but until then, on a day-to-day basis, patients are living with symptoms like anxiety, constipation, sleep problems, that kind of thing. And because of the way that clinical research works, almost no one's ever going to do a randomized control trial of symptomatic management treatments. So you could take 10 drugs for your sleep disturbances in Parkinson's or ALS or MS, and the problem is it's all trial and error. And so they tried out a lot of things, and what you find sometimes is that side effects of one drug, that helps you sleep, can make another symptom like the constipation worse.
Right.
So the idea was, well, if we share everything that we've tried, then would that mean that other families don't have to go through that trial and error? So the basis was is that everybody was to share and be open about their data. Then perhaps we could, try and minimize the amount of disruption. So the idea was to take structured questions, so not just free text. We've had for 20 years, Usenet and listservs and BBSs, things like that, of conversations between patients. The idea here was to take structured data, so to take patient-reported outcomes, the same types of questions that we ask in a clinical trial, and to flip those over to the patients. So now they can see them and they can chart their progress on a series of visualizations and graphs. So that's really grown over the last 6 years. We started off in those neurological conditions, and as of about this time last year, anyone with any condition can join the system. And we just surpassed 150,000 patients yesterday. And when you look at the numbers like Facebook, a billion people or something like that, it doesn't sound like a lot. But, just last night we were in the bar and we randomly met someone who's got a family member that's on Patients Like Me, and he had a rare disease, and when he was diagnosed, he said that it was really useful to meet other patients and know that he wasn't the only one. And so for me, when we talk about technology and big healthcare and stuff, we think about the millions. But for me, and what I get out of it, it's those stories. It's the 1s and 2s and 3s. But yes, still, a billion people would be great too.
Well, you mentioned research, trial and error. How does this play into Patients Like Me, and can you really use social communities to do research?
Yeah, so that's what the whole mission of what we've been trying to experiment with is to say, if you look at the way that most research is done, you have clinical trials, you have observational studies, you have questionnaires, you have registries. Well, all that tends to rely on what the clinician says, what the doctor says. So in the case of multiple sclerosis, for instance, a relapse is effectively whatever a doctor says is a relapse. There's not many ways for patients to really give their experience. So what we were trying to experiment with was if we take validated questionnaires and we field them over the internet and we try and do some work on data quality to ensure that patients are who they say they are and that the treatments are what they say they are, well, can we actually discover some things? And we started off very small, just with sort of letters to the editor saying things like, oh, did you know this symptom is more common than we thought it was, or stuff like that. And as of now, we have about 23 peer-reviewed publications, and those are in journals, up to Nature Biotechnology, where we did a clinical trial over the internet, or something approaching a clinical trial. So I think we've really tried to be the research credibility core in the Health 2.0 space to say that, look, you have to pay attention to this. This is a new way of doing research, and it can be much faster and much more involving of the patients, because, the other thing that involves is if we want to do a research study with you, we probably have to drag you to the hospital.
Right.
And you might not want to be in the hospital on a Friday morning for 5 hours of tests. If there's a lot of that stuff that you could do at home or on an iPhone or an iPad or whatever, well, why don't we do that? And I think there's a few basic things you could do to validate that the quality of the data is sufficient. But once you've done that, there's no marginal costs in asking one patient or 10,000 patients. Right. So that's really where I think the power comes from.
Okay. And you've recently moved from the US back to your native UK. how do you see there being differences in the two systems of healthcare?
Yeah, so I trained in the UK, obviously, and I'm originally from there, and I moved to Boston for 3 years to head up the R&D team at Patients Like Me. My objective in coming back to the UK was to look at that country possibly as a stepping stone to other countries like the EU, because I feel like with a nationalised healthcare system like the NHS, you have aligned incentives. And when I was in America, I had a tremendous learning curve about, managed care and private healthcare insurance and deductibles and co-pays and all this kind of stuff that many of us in the UK especially don't think about. And we found it hard there to sort of approach potential payers or large hospitals and say, look, we have something that can improve the outcomes of your patients. Would you like to give it a try? They would frequently think in terms of, well, is this going to affect our risk pool? Are we going to attract these expensive patients with rare diseases with expensive drugs? Do we want to really be doing that? Whereas if you look at something like the National Health Service, they have incentives to look after the outcomes of people they treat. So I remember I had a little lump removed from my neck by a dermatologist in America, and he told me that he'd make more money if he made a longer incision, removing a cyst. And so I felt like I kind of needed to get myself away from a healthcare system where that was the measurement. And we're making slow steps in the UK, but eventually I do think that hospitals and doctors and people like that will be evaluated on the outcomes of their patients, whether that's HbA1c or adherence or what have you. What I'm trying to be a voice for in the UK is to say, well, make sure those are outcomes that matter to patients. It's not just days spent in a hospital bed or whatever. It has to be, whatever's important to the patient. Could I get back to work? Right. Can I use my computer without, getting eye pain or whatever? And that's really what we need to focus it around. But I think the UK is going to be an interesting testing ground. If a drug gets approved by NICE, for instance, that's frequently a signal to the rest of the market. So it could be similar there, that the lessons we learn in proving out that Patients Like Me can be an intervention might be able to be applicable to other healthcare systems too.
Okay. And so tell me more about Patients Like Me, your interest in the UK, why the UK, what specifically are you wanting to do there?
So what I would like to do is, when I mentioned Patients Like Me as an intervention, we've published 2 studies, one in 2010 in the Journal of Medical Internet Research called Sharing Health Data Leads to Better Outcomes, and another one in Epilepsy and Behavior about the benefits of an epilepsy community for people with that condition. And in both of those, what we found was when patients self-report, and that's biased, certainly, they reported some improvements that we didn't expect to see. Things like improved medication adherence. We don't actually have an adherence module in Patients Like Me. That's just coming from interaction between patients. Someone with HIV saying, look, I took a drug holiday because I didn't like the side effect, and look at my numbers, they all spiked, so don't do that. And when that advice comes from another patient, it comes in a much more acceptable wrapper than when it's just a doctor or a nurse bashing you on the head saying, take your pills, take your pills. Right. So we saw that adherence thing coming through. The other thing we saw in epilepsy, which was really interesting, was people said that they were using the emergency room less, that they weren't having seizures that required them to go to the emergency room. And that's a mix of, I think, better self-awareness of when they're going to have a seizure, because they can talk to other patients and say, I had deja vu 5 times yesterday. Someone can say, well, that's not normal. You might want to get that checked out. And so these benefits, varied across the spectrum, but the thing that was kind of crazy about it is we decided to look at the relationship between the benefits they saw, things like side effects and symptoms and ER visits, and match that up with how many friends they had on the network, which we got them to self-report, and we also validated that by looking behind the scenes at who they were private messaging. And what we saw, and it's in the paper, is a dose response curve for friendship. So the more friends, the more strong ties you have with other patients that are like you, the more you get out of the system. And the reason why that was so crucial is you'd think epilepsy is pretty common, right? I mean, everyone can say it and spell it at least. Yes. We found that 1 in 3 of our patients who'd had seizures for an average of 20 years had never met anyone else with epilepsy in their entire lives. Wow. And I always think, what we do with maternity when we have, pregnant women all talking to each other and we bring them into groups and we do coaching. Groups, that's just normal. That's just natural, right? Imagine if you had to raise a child without ever having met anyone else that's mothered a child. It would be very difficult. And yet with patients, we kind of say, well, here's you, and don't talk to anyone else, and your data's locked down and it's private, and don't talk to anyone else in the waiting room. Right. And off you go. We'll just shove you out the door. So I think that's been really interesting. But, and here's where the but is, and here's what we're doing in the UK. Me, who made the epilepsy community, saying that the epilepsy community helps people in the subset of people that decided to respond to my survey, is hugely biased. And it's just self-report. And patients saying they think they use the emergency room less, or they think they use their medications better. That's a level of evidence which is suggestive and directional, but it's not going to cut the mustard for me to say clinically,
right.
Or to say, you know, as a business model, look, we can improve outcomes in your population, pay us to help manage your population. So the NHS is a much better environment in which to test out that an intervention is working. That's like ours, as opposed to the US where cost is such a big factor. So about 1/3 of Americans avoided going to a healthcare professional visit in 2010 because of costs.
Simply because of the expense, correct.
So for all we know, we could be doing a fantastic job, but if a whole bunch of employer costs rose, or you know the care plan changed in terms of what drugs they could have or whatever, all of that noise could wash out any signal that we had. So at least with the NHS, and it does have plenty of problems, I grant you, it's a more level playing field, and you know someone who's wealthy and someone who's poor have a slightly more equal chance at sort of being at that same level. So if we were to add some better outcomes, hopefully we'd see kind of that rising tide come through. So I'd love to try that out in the UK and maybe do a randomized control trial of friendship on social networks.
Right.
And then we could prescribe that.
Well, and to throw you a little bit of a curveball, but how do you see this relating to participatory medicine?
Yeah, so I mean, the thing that's interesting is the benefits we saw did not come out of any tools that we did. It was patients figuring it out and problem solving with each other, and they were just, you know, responding to each other's needs and supporting information when it was needed. They weren't giving medical advice; they were sharing their experiences, and I think that that is a form of medicine. Even more than that, a slightly meta level, I think that healing other people with information is itself healing. You know, people who work in healthcare professions get a lot out of helping other people, and I think that giving that opportunity to patients as well is something that is hugely participatory. Bringing in better knowledge of outcomes and data and the terminology that doctors use also puts patients in a much better level to start asking their own research questions. We have patients in our site right now who are trying to analyze the results of clinical trials even before they've completed the study. So they are educating themselves and using the tools that are out there through things like the open access movement, which makes it easier for patients to read the exact same papers that their doctor can read. So I think it's really an exciting time, and you know, groups like this are part of this ecosystem of this mission that we're trying to get to, of more participatory medicine.
And so what's your hope for the future in a 1-year, 5-year plan?
So I think the 5-year plan is that everything that we're talking about as exciting is normal. It's deadly dull. That you don't need to go and say, oh gosh, I've got an app, or oh, it's on the internet. You know, it would be like saying that you read something in a newspaper that was printed on paper. You know, we don't need to know the methodology. It's just normal. And I think there are a few promising aspects of that we're starting to see around the place. But I want what we're talking about, the medicine 2.0, the health 2.0, just to be medicine, just to be health management. So that's what I would love to see in 5 years, and hopefully it's groups like this that'll get us there.
Thank you so much for your time.
Great,
Everybody,
thank you.
Paul Wicks. So,
Thanks.
Thank you.
And I'm going over here now.